All right. Hello, everybody. So this is our presentation on healthcare security within physical and digital threats in modern medicine. My name is Daniella. I'm a cybersecurity engineer, and I'm with the Lioness Instincts, educating people about physical and digital safety. All right, let's get going. All right, so when it comes to healthcare security, there are two fronts, but altogether there's going to be one fight. So you have your physical threats and your digital threats. So physical threats can be anything like unauthorized access to facilities, theft of devices, medication tampering, sabotaging medical devices, and disruptions of any utilities that can put people's lives at risk. And when it comes to digital threats, it could be anywhere like data breaches, which we have example of that we will get into later, ransomware, insider misuse of patient records. So like think of like a doctor or a nurse accessing a record of someone that they are not working with, and they're doing so for whatever malicious reason that might be. Unsecured vendor connections and unencrypted devices containing personal health information, otherwise known as PHI. So, who are the threat actors? There are multiple types of threat actors that can occur. So we have careless employees, and these are staff who fail to follow protocols, and oftentimes they will leave PHI exposed. They might lose devices, or they might skip required risk assessments before they access data or they access a secured area in a hospital or doctor's office. And next, what we have here is malicious insiders. So these are employees who intentionally access or leak patient records. And a lot of times it can be motivated by curiosity, financial gain, or personal grievances. Next, we have disgruntled employees. So this could be former or current staff who retaliate against their organization by accessing or exposing sensitive data after disciplinary actions or terminations. And lastly, we have vendors and contractors. So these are third parties with access to systems or physical spaces who lack proper agreements or oversight, and they create compliance gaps. So what are some physical security risks in healthcare? There are multiple. So like we mentioned before, unauthorized access, and this could be like intruders, people going into patient rooms when not escorted or given permission, and also accessing server closets where networking equipment is stored. There's also medication tampering, and this can happen through drug swaps or mislabeling by individuals with unsupervised access to pharmacies or treatment areas. And lastly, we have device and utility sabotage. So this can include the hacking of networked medical devices or accidental power shutoffs by service workers. And even with backup systems, the disruptions can be dangerous because in hospitals, there are, for example, life support systems that keep people alive. All right, so what are the digital security risks in healthcare? First off, we have identity fraud. And this is going to be using like stolen insurance cards or patient information to obtain medications or treatments under a false identity. Next, we have PHI data theft. So PHI stands for personal health information, like I said before. And these breaches can often happen via stolen laptops that have PHI or any other type of sensitive data. It can happen from outside attackers or malicious insiders who exfiltrate patient records. And lastly, we have system sabotage. So this would be basically attackers attacking hospital or doctor's offices, computer systems, and, putting ransomware in them or attacking them in some way, like a DDoS attack. So, and what happens during during a ransomware is that it will lock clinical staff out of critical systems during active patient care, which can actually bring a very dangerous situation where there might be life-saving information on these systems, but when the hospitals don't have access to it, that can create a very, very dangerous situation. So here are examples of real incidents with actual consequences. Anthem Health. So Anthem Health is a health insurance company, and what happened was that they failed to conduct a required organizational risk analysis, and because of that, they had a lot of vulnerabilities in their systems that went undetected. And because of those vulnerabilities were undetected, an attacker took advantage of those vulnerabilities, exploited them, which led to a data breach. And Anthem Health had to pay $16 million in a HIPAA settlement. And at the time, it was literally the largest settlement in the world of healthcare. The Feinstein Institute of Medical Research. So in 2016, a laptop from an employee was stolen. As a result, there was sensitive information of patients that got exposed. And what allowed for this sensitive information to get exposed in the first place was that the device lacked encryption, and it allowed for the PHI to be accessed by unauthorized parties. And this would have been completely preventable by having the proper physical and digital safeguards in place. Memorial healthcare. So in Memorial Healthcare, employees were accessing patient records without authorization over an extended period. And then in 2017, an OCR settlement highlighted the need for robust access controls and audit logging. So this would basically keep track who is accessing the data. And all right, let's talk about the Center for Children's Digestive Health. So the Center for Children's Digestive Health in Illinois improperly shared files containing PHI with a file storage vendor called Filefax Inc. And what happened was that they did not have a business associate agreement in place. Now, what would this business associate agreement would have done is that it would have required both organizations to basically require individuals who come in contact with the data to properly protect it. So there wasn't any agreement in place to properly protect the data that was being accessed. So here's an example of physical violence against healthcare workers. And at the bottom, right here, we do have like a link to the article. But in Maryland, a nurse had gotten attacked by a patient who basically was not escorted by the proper people. And this happened in the emergency room that she worked at. And as a result of the incident, other people who were working around her either had to retire early or they had to quit their jobs. And I believe this nurse right here, she actually quit her job as a result of the incident, or like she was just rendered not healthy enough to work because like the beating unfortunately was really just that awful and bad on her. But healthcare workers do face an increased risk of physical violence and threats on the job, especially in the emergency medicine rooms. So this is the HIPAA regulatory framework. So these right here are the safeguards that HIPAA requires organizations to implement. So first off, we have the technical. So this could be encryption, audit controls, and access management. Next, we have administrative controls. And these are policies, risk analysis, and workforce training. So think of like the employee trainings that your company has you do. That's what it would be like. And then lastly, we have physical security. And this would be facility access controls, device security, and workstation policies. So when it comes to physical safeguards, there are different items that we can implement. So first off, we have badges, and when someone is terminated or they quit their jobs, it should be enforced to deactivate their access. Next off, we have networking equipment. So this would basically be securing servers or any other types of network equipments like switches and routers and cables in a access controlled room. So therefore only people who have access to the room, like a key, a card, or a pin to access the room, can only access it. And as unescorted visitors. So never allow unescorted visitors in clinical or data sensitive areas, because again, you don't know who these people are and you just don't not know what they're capable of. So make sure they were always escorted. And when it comes to documents, documents with PHI should be kept in the proper area. It should be kept in an area that shows, that labels that PHI is present. And it should have like the proper, for example, like a lock on it, or there should be some kind of proper access control to make sure that only those who can access it can access it. So what are some red flags to recognize? Number one, unbadged individuals. So someone who's moving through a restricted area without a visible badge or escort should be a red flag that you should recognize. And then next, we have exposed PHI documents. So this could be like patient files, charts, or printouts left in plain sight at workstations. And lastly, we have unknown service workers. And this could be anywhere from like your unverified contractors or maintenance personnel near servers or utilities used by a hospital or doctor's office. So what are some digital safeguards, mitigation, and detection? So this is what you should watch for. When it comes to unauthorized PHI access, you should look for audited logs showing staff viewing records outside their care role. For example, like a specialist working in one specialty, looking at records of another patient, in another specialty, being taken care of by a doctor in another specialty. And that right there is an indicator of an insider threat or an account compromise. Post-breach data leakage. So after a data breach, there could definitely be more signs that a data breach has happened that can continue and linger on. So this could be like patient information appearing externally following a system incident. So patient information would be basically appearing in areas where it shouldn't be, like the internet. And that's often the first sign of a successful data exfiltration. And lastly, we have unverified vendor access. So this could be like third parties connecting to systems without a signed business BAA agreement or documented access approval to create immediate compliance exposure. So here are some key takeaways. Number one, know your threat actors. Know who your insider threats are likely going to be. Understand that there will be negligent staff, and third-party vendors can be dangerous. And then also comply with HIPAA, conduct regular risk analysis, maintain BAAs with all vendors, and document your safeguards. And train your staff to spot risks. Employees are your first line of defense, and oftentimes data leakages do happen because of human error, whether intentional or not. So teach employees to recognize and report both physical and digital red flags. And layer your defenses. Encryption, access control, badge policies, audit logging, they all work together. And in cybersecurity, we call this defense in depth. And no single safeguard is sufficient alone. And lastly, remember, the most costly breaches in healthcare history were preventable. The organization that avoid them invest in both people and process, not just technology. All right, well, that was the presentation. So if anyone has any questions, feel free to ask.
That's very good insight, Danny. If you want to stop sharing your screen, I think we should be good.
Okay.
Yeah, so as we mentioned earlier in the presentation, this is guidance from security professionals in this space, things that we recommend, things that we've seen in the industry. So if anybody has any questions, feel free to put them in the chat, or you can always reach out to us later, and let us know if there's anything you'd like to see as far as safety concerns when it comes to both digital and the physical space. All right, and if not, we'll happily give folks time back. We have other pre-recorded videos from this week. Our digital safety is physical safety talk, and this one will be posted on our YouTube channel by early next week, and you can check it out for other safety information. We also released a digital safety bundle in our Etsy site. So if you know anybody that's looking to do an audit of themselves and fully understand where they're exposed in our digital landscape, this is a great tool to go through to figure out, social media settings, pictures that are shared, where you might have accounts online, and just other things to think about when it comes to our digital space. You can find it on our Etsy site. It's called the Complete Women's Digital Safety Bundle. And of course, if you have any questions, feel free to find us on LinkedIn, Instagram, Facebook, or shoot us an email. That would probably be the quickest response.
Awesome. Well, thank you for coming, everyone. This was my first presentation for Lioness, so hope I did well. But thank you, everybody.
Thank you. Have a good one.
Bye.